Good morning. How are you? Good or bad or so? I hope you feel good because it's great. By the way, I'm fine and good, same as always. I think you can guess what kind of action I'm doing right now. Yes, it is sign language. Sign language, of course, associated with hearing impairment or hearing disability, like topic that we will talk about today. So without wasting our time, let's proceed to the first presenter. Let's go!
Before we proceed to our presentation, let me introduce our team members. But before that, let me introduce myself. My name is Nur Hasanah binti Harun as the first presenter. The introductions, actually, they have two terms that always used for the hearing disabilities, which is hearing impairment and also deafness. The definition of hearing impairment that was defined by Individual with Disabilities Education Act or IDEA, they define that hearing impairment is an impairment in hearing, whether permanent or fluctuating, that adversely affect child's educational performance. The terms of hearing impairment was used to describe people with any degree of hearing loss from mild to profound, include those who are deaf and those who are hard of hearing. Later I will explain what is the degree of hearing loss, like mild and profound. Basically, for the hearing impairment, their degree or their levels of hearing loss was below of 90 decibels. So we proceed to the deafness. Deafness was defined as refers to hearing loss so severe that is very little or no functional hearing. So the degree of deafness or the degree of the hearing loss was above 90 decibels. Next, the types of hearing impairment. Basically, they have three common types of hearing impairment. The first type is conductive hearing loss. The second type is sensory neural hearing loss. And lastly, the third type is mixed hearing loss. So, what is the difference between these three? Types of hearing impairment. For the conductive hearing loss, it occurs in the outer or middle ear where sound waves are not able to carry all the way to the inner ears. And it is because of obstructions such as wax or other damage in ears. And how to treat it? It may be reversed through medical or surgical intervention. For the second types, the sensory neural hearing loss is actually the most common types of hearing loss. It is occur in the nerves and it is permanent. It is because of aging, disease, injury, and exposure to the loud noise. Because of there is no way to repair the sensory neural hearing loss, hearing aids can help to solve the problems. Lastly, the third type is mixed hearing loss. It's actually a combination of conductive hearing loss and sensory neural hearing loss. If you are diagnosed to have this impairment, you need to contact with the is the level of noise, or what is the level of sounds? This picture provided 10 levels of noise levels based on the decibels, which started with 30 decibels, which sounds like whisper, 50 decibels sounds like moderate rainfall, 60 decibels just like typical conversation. After that, 80 decibels just sounds like blow dryer, and 90 decibels, which I was mentioned before, it just sounds like a motorcycles. Then the number of decibel was getting higher, which is 105 decibels sounds like a chainsaw, and after that 110 decibels just like the maximum volume of your devices, or which is your phone or your laptop. After that 120 decibels just sounds like the sirens of ambulance. The second last is 140 decibels, just sounds like jet aircraft. Lastly, 164 decibels just sounds like grenade. I hope you can imagine what kind of sounds and what kind of the noise that refer from base to decibels, because after this I will explain the hearing loss classification, which related with the decibels. So, what is hearing classification for? Hearing classification was to determine the levels of hearing loss, which divided into 5 categories, which is normal, mild loss, moderate loss, severe loss, and also profound loss. So let's see the first category, which is normal, and the levels is below than 30 decibels. The functional definition here is the person will hear something that near them or within their normal limits. And then the second category is mild loss, which the level is 30 until 55 decibels. If the person in this category, they will have or they will face the difficulties in conversation, which the speech was beyond 3 or 4 feet, and in this category, the person needs hearing aids. Next, the third hearing category is moderate loss, which is between 55 until 70 decibels. In this category, hearing aids and special training in speech and language is essential. After that, the fourth category is severe loss, which is the level is 70 until 90 decibels. If the person in this category, they will have or they will face the difficulty in hearing speech with hearing aids, and they must be educated as a deaf person, so it means they need to learn the sign language. Lastly, the fifth category is profound loss, which the level is above 90 decibels. If the person in this category, they was defined as deaf person, which they cannot rely on hearing aids as their primary channels of communication. Here I have attached a pictures that illustrate the different classes of hearing loss for you to be more understand and to be more clear. I think that's all for my presentation. Let's proceed to the next presenter.
Assalamualaikum warahmatullahi wabarakatuh, and hi everyone. My name is Wan Hasan Adli bin Wan Muhammad, and also people call me Wahab. Alright, before start the presentation, I would like to say thank you to the previous presenter for the introduction of this knowledgeable topic. I hope you guys gain some knowledge or a little bit knowledge from explanation from the previous presenter. Alright, how are you feel today, guys? Are you feel sleepy, fresh, or what? Don't worry, I will explain as simple as I can. Okay, without wasting any time, let's proceed to the presentation. Today, I'm going to share to you all about causes. The first is causes, the second one is risk factor, and also the third one is prevention of hearing impairment. First and foremost, I would like to explain about causes of hearing impairment. The first causes is the mesh to the inner ear. The mesh to the inner ear could happen if we expose too much on loud noise or voice. For example, we set up TV volume too high and we work at noisy place such as factory or building construction. Do you know the implication of the mesh to the inner ear can cause tear on our nerve cell in the cochlea that function send sound signal to the brain. When these nerve cells are damaged, electrical signals are not transmitted as efficiently and hearing loss could occur when this happens. Next, ear infection and growing of tumor also can cause hearing impairment. Ear infection can occur when one of our eustachian tube becomes swollen or blocked. Eustachian tube is located at the middle ear. It close to the eardrum. Alright, do you want to know why eustachian tube is blocked or swollen? The major causes is we use an earwax removal that contain bacteria or virus because some people did not keep this tool in the safety area. Then, about tumor, I think I cannot share in detail because I just can say that tumor is an abnormal mass of tissue that accumulate in our body cell. If we study in detail, there has a lot of types, causes, and prevention. But if I share to you all, it might take a lot of time. Okay. The last causes is rupture of eardrum. I feel that you all might be wonder, is it similar or different between the mesh to the inner ear, like my first point, and rupture of eardrum? Yes, it is different because eardrum is located in the middle ear, while the first causes or the first point is involved inner ear. But they have a similar causes, which is occur because we expose too much on loud noise. As a result, it can affect our hearing function when the eardrum being ruptured. Also, similar like my first point, the mesh to the inner ear that can causes hearing loss. Alright, next we move to the risk factor of hearing impairment. As we know, exposure to much on the loud blast of voice is the common risk factor of hearing impairment, right? So, it depends on us on how we'll deal with this problem. But some people who are work in the loud noise environment cannot prevent this, but they have an initiative to reduce the noise. The second risk is heredity or family history. Your genetic makeup may make you more susceptible to ear damage or hearing impairment. So, you need to be fully aware when your family members experience or diagnosed as hearing impairment patient. Do you know, some medication also has an effect towards our hearing. For example, drugs such as the antibiotic gentamicin and certain chemotherapy drugs can damage the inner ear. Not only that, but consuming high dose of pain relief also can affect our hearing function. So, the primary step to prevent consuming high dose of medicine is always consult the doctor by asking them. Asking what? Asking them how much per day we should consume the medicine. But as we know, the pharmacy department also state this at the medicine box or plastic. The last risk factor that I'm going to share is a result from some illness. For example, high fever, which can damage the cochlea. Cochlea is consists of nerve cell, like I told before. It is function to send signal to the brain. Therefore, your brain an ear could not function well when the cochlear been meshed. Okay, then I don't want to explain too much because we lack of time right now, and we move to the last discussion, which is prevention of hearing impairment. Alright guys, the first prevention of hearing impairment is by we protect our ear. Protect our ear is we use something that can reduce or limiting the noise intensity. For example, we use earphone or earplug when we work in the loud noise environment. One more thing that we should take serious is please limit the volume when we watch the television and also listen to the music. Because I know some people satisfaction is listen and watch something with high volume. So please take it serious and be aware about this. Alright, the second prevention that we can do is have your hearing tested when you are always involved in noisy environment, and also when your hearing is interrupting or you feel something occur in your ear. You need to check, okay, if all this kind of issue like I said before occur to you, because we cannot detect and diagnose the disease or the impairment by ourselves. Last but not least, please use safe earwax cleaner because some ear removal can cause damage to the ear. Like I told before, it might be contain bacteria or virus, and also some tools like a steel can swell your ear. As my last word, please take care of your ear as much as you can because hearing is one of the best gifts from God, and not all people can listen and hear perfectly like us. Alright, I think that's all from me. Thank you for lending your ear, everyone. I appreciate your cooperation and attention towards my presentation. If you guys have a question to ask, you can ask. Maybe you are not fully understand on certain point or my information is not clear. Okay, bye. Assalamualaikum warahmatullahi wabarakatuh, and I pass to the next presenter. Thank you once again.
Okay, hi, good morning. So, my name is Nabila binti Rahmat, and I will continue about the tips and technique how to handle a person with a hearing impairment and how to communicate with them. But I will show you first the hearing aid used by a person with a hearing impairment. So, this is the old one that have been used in 19th century, and this is the latest one which have been categorized in a few types. Okay, now let's move to the tips and technique. First, you have to know that there are multiple ways or techniques how to communicate or handle a person with a hearing impairment. The most common ways is using sign language or body language and body gesture. You have to know that majority of a person with a hearing impairment know how to do sign language, but not for able person. As you can see this picture, this is the most basic way that you can learn by yourself how to do sign language. A person in hearing impairment in general are visual people, right? So they know how to communicate using gesture or sign language. You don't have to be afraid and don't be embarrassed. It's just important that you can communicate. Show with your face expression if there is something like painful or scary or nothing that to worry about.
By the way, I found a video. I'm not sure if some of you already watched it, but I found it was very interesting. So let's watch it first.
So, this video is about a person with a hearing loss is moved into tears because his neighborhood learns sign language just want to talk to him.
Evet, kameraman kaydı gitsin arkadaşlar.
Mala hazır ol. Şimdi. can you slow me down, please? Anlaşıldı.
Okay, now what if someone or you who doesn't even know how to do any sign language? And suddenly you meet a person with a hearing impairment. How are you supposed to communicate? And what are you supposed to do if you doesn't even know how to do any sign language? The most important thing is let them guide you. Let the person with the hearing impairment take the lead so they can set up what kind of communication tools that they want to use. Just let them make decision because they deal with this every day, right? So they are used to it and they know how to do. The third tips is be prepared in terms of communication tools. So let's say if you are a teacher at a school and you know that you have a student with a hearing impairment, make sure you have some sort of communication tools like a paper, like a pen or any pencil, something is ready. So if somebody comes up, you already have that. Or you have a computer or any gadget like a smartphone, you can just type on there or something like that. Okay? The fourth tip is be patient or repeat and refresh if necessary. I know that it's not easy to handle a person with any kind of disability, so you have to make sure you have a lot of patience trying to figure out what is the best way for communication to happen between you and a person with a hearing impairment. If they can't hear you, try to say the same thing in different way might help. If there is more than one person in conversation, that turns to talk. No one can read multiple people at once, right? The second last point is always face a person with a hearing impairment and keep in a distance. Make sure you make an eye contact and maintain it while you are talking. Stay in their field of vision and don't ever try to look away when you are talking or don't ever cover your mouth because majority of people with a hearing impairment are rely on lip reading to help them understand. And make sure you stand a meter or two away from a person with a hearing impairment. This is most important for hearing aid users, lip readers, and signers. Don't mumble and make a silly voice when you are talking. And the most important thing is don't ever shout to them. It will distort your lip pattern and hard for them to follow. They cannot hear you, so raising your voice will does not help you deliver what you are going to say. Just use normal lips movement and speak clearly. The last tips and technique that you have to know is check noise and lighting. Turn off or move away from a noisy place. Make sure your face is not in a shadow or dark place and there are no strong light or sunshine in their eyes. There is do and don'ts you have to bear in mind. Every deaf person is different, so you will need to be flexible in your approach. Remember, being deaf does not mean being incapable. That's all from me.
Hai, Assalamualaikum warahmatullahi wabarakatuh. My name is Muhammad Hakim bin Muhammad Azmi as a fourth presenter to present about this topic. Now let's move on to the activity and sport suitable for hearing impairment and their special facility around the world. Activity suitable for hearing impaired student. Okay. First of all, commonly, hearing impairment is related only to hearing loss and does not affect the capacity for practicing physical activity. We as a future physical education teacher must know that the barrier is only on communication between them and other peers or teachers. Therefore, learning a sign language is the most suitable activity for them and the best way for them to enhance their communication skill. When they understand the sign language well enough, it will be so much easier for them to understand the instruction and feedback from teacher during any activity. Besides that, learning a sign language is good for their cognitive development too. as there are no limitation or effect on their capacity on doing physical activity like able student. Conducting any suitable activity is easier for us. We can conduct any kind of activity as long as we apply some adaptation to make it suitable for them. You can conduct any kind of activity to hearing impaired student, whether it will develop their cognitive or physical, as long as you apply some adaptation that listed. These are the suggested adaptation for making activity suitable for hearing impaired student. First of all is sign language communication. Teacher that use sign language fluently will maintain direct communication with the student with clear dialogues which allow the student to have more confidence when on what they are doing. And it will be easier for us to give them instruction and a feedback. Next one is a visual cue. Instead of using a soundtrack such as whistle or voice, some visual cues should be used, such as image, flags, and demonstration material. And the most important thing is advanced safety precautions. We must know that hearing impaired student has less capability to be aware to surrounding. This is because they could not hear what coming from behind. Safety precautions such as reminding students to not play aggressively and conducting the activity at most safer place is important. Now, let's move on to the sport suitable for hearing impaired people. A hearing impaired athlete or person is able to compete just like an able person without significant restriction, but only the exception is on communication barriers. In team sport and some individual event, hearing loss can be limiting. However, this limitation would disappear with adjusted rules of the games. The sport I'm going to present is now a special sport, and the only adaptation are to making the auditory cues visible, such as the use of strobe light for starting signal or using a flag for refereeing. Okay, for the individual sport is swimming and athletics. Swimming and athletics such as sprinting or a field event is available for people with hearing impairments, and it is participated by a hearing impaired athlete even at an international level such as Olympic Games. Swimming and athletics consist of a variety of events that are available, and they use the same rules as the normal games. But some different in rules and environment of competition when hearing impaired athlete participated is it is customary for spectator not to cheer or clap but rather to wave. We cannot make any loud noise if the event is participated by the deaf athlete. And the race is started by the wave of flag instead of a gun. For a team sport, it is cricket and football. Hearing disabilities are no obstacle to play cricket and football. In the games, there are few rules and regulations that are specific to the different impairment group. There is a minor difference between a hearing impaired cricket and football match and the normal match. The level of noise during the hearing impaired cricket and football and the typical normal match is huge. The number of decibel is a main factor. You have to know that the players involved in hearing impaired teams should be able to encode up to 55 decibel of sound. If one of the team members is able to encode sound that exceed the 55 decibel, that individual is not eligible to partake in deaf cricket or football match. The rules are the use of flag and hand gesture is applied by the official for the match. That is the difference between the normal and the deaf games. For special facilities for hearing impairment, I would like to expose to you guys to this society in India, which is called Haryana Welfare Society for Hearing and Speech Handicap. It is established in the year of 1971 with a view to providing education, vocational training, counseling, guidance, and remedial service to hearing impaired children. This society had helped 1,000 of hearing impaired children to get a similar or maybe more advanced education. Hence, this society has set up more than 7 welfare centers around India. Before I end my presentation and pass it to the other presenter, let's see some videos.
My name is Muhammad Aziz and I will proceed to the famous athlete and famous person. Alright, for the famous athlete categories is Tamika Catchings, or her real name is Tamika Devonay Catchings. She is an American retired professional basketball player who played her entire 15 years career for the Indiana Fever of the Women's National Basketball Association, WNBA. Born in July 21st, 1979 at Stratford, New Jersey, United States, she was diagnosed with moderate to severe hearing loss in both ears when she was a toddler. As a child, she struggled with hearing and speech impairments, wearing hearing aids and bullying. The basketball court became a refuge for her. In year 2000, Catchings was honored with the Reynolds Society Achievement Award by Massachusetts Eye and Ear Infirmary in Boston. The annual award is given to an individual who has overcome hearing, vision or voice loss and has distinguished him or herself. For her achievement and awards, Catchings has won a WNBA championship and got Most Valuable Player in the finals in 2012. In 2011, she won WNBA Most Valuable Player Award, 5 WNBA Defensive Player of the Year awards, 4 Olympic gold medals, and the WNBA Rookie of the Year award. She has also been selected to 10 WNBA All-Star teams, 7 times All-WNBA First Team, 10 times WNBA All-Defensive First Team, and led the league in steal 8 times. She is one of only 11 women to attain all 4 accolades. Accolades mean anugerah or penghargaan. In 2011, Catchings was voted in by fans as one of the WNBA's top 15 players of all time. For the famous person is CJ Jones. CJ was born on September 29, 1950 in St. Louis, Missouri, United States. Actor, comedian, writer and director, CJ John was one of 7 hearing children born to deaf parents who communicate in American Sign Language or ASL. At the age of 7, he was struck very ill with spinal meningitis and consequently lost his hearing. Spinal meningitis is an infection of the fluid and membranes around the brain and spinal cord. Once infection starts, it can spread rapidly through the body. Without treatment, it can cause brain damage in a matter of hours and can be fatal within 24 hours. For his achievement and awards, CJ Jones wins Best Actor for his performance in Door in the Woods at the Nashville Film Festival in 2018. Also in the same year, he was honored to receive the Media Access Award at the SAG-AFTRA Harold Rosell Award. The annual ceremony is paying tribute to pioneers of the entertainment industry who have worked to advance public awareness and inclusion for people with disabilities. CJ is a legend in the deaf world, acclaimed for his humor and inspiration. He has done it all: TV, movies, educational films, and theatre. He has toured with his stand-up comedy all over the world. He continues to use his never-ending passion in acting, producing, and directing to give back to the deaf and signal language community. For the conclusion, to wrap it all up, hearing impairment is the degree of hearing loss from mild to profound. Categories included who are deaf, and they have 3 common types of hearing impairment, which is conductive hearing loss, sensory neural hearing loss, and mixed hearing loss. Every person with a hearing impairment is different. Not majority of us can do sign language, so we have to be flexible in our approach when we want to handle or communicate with them. Even they got a communication barrier, they still physically and cognitively capable on performing the activities such an able person. That's all from us. If you guys have any question, you may ask us. Thank you very much.